Welcome back to Jersey Matters. One county in North Jersey has made a bold pledge. They promise to be stigma-free when it comes to dealing with mental health issues. Our Sherry Karabin has the story. Sherry.
Thank you, Larry. When it comes to a physical illness, most people don't think twice about seeking medical help, but that's often not the case with anxiety or depression because of the fear of being stigmatized. But healthcare professionals and others are working to change this by raising awareness about mental health in an effort to eliminate the stigma.
Our son was having difficulties in high school socially, and he ended up with some suicidal ideation issues.
Fast forward several years later to today, and DeMarco and his wife Karen say their son is doing well after getting the help he needed. Treatment, they say, he initially resisted because of the stigma often attached to mental illness.
Unfortunately, there are so many people who don't seek help and don't seek aid because of the stigma that's attached with mental illness, particularly young people. There are so many children, teenagers, high schoolers who are suffering in silence with anxiety and depression.
But the DeMarcos are doing their part to change this, embracing the stigma-free movement, gaining momentum in the Garden State and elsewhere. That's led many municipalities, schools, churches, and businesses to declare themselves stigma-free zones. On May 1st, the DeMarcos attended a town hall meeting at Englewood Hospital and Medical Center to learn more about the initiative that's designed to encourage people to seek treatment for mental health and substance use problems.
We've been trying to get things moving within our own community. There was a stigma-free resolution that was passed, but unfortunately it hasn't really gone much further than that.
During the event, officials proclaimed Englewood Hospital and Medical Center a stigma-free zone.
Part of reducing stigma is educating people about mental illness. So just like you and I are talking about the psychiatric illness, like we might talk about diabetes or high blood pressure, that helps. And it also encourages people to take action.
Those who turned out were able to find a wealth of written material on mental illness, substance use, and community treatment resources. But the highlight of the event for many parents and caregivers was the information provided by keynote speaker Anne Marie Albano, a professor of clinical psychology at Columbia University Medical Center. Albano discussed anxiety and mood disorders in children and teenagers and how to distinguish between normal everyday fears and a more serious condition.
Anxiety starts young, by age 4. The more it continues over time, and it does increase in prevalence, the more likely it's a gateway to depression in adolescence and then substance use. And the lethal combination of anxiety, depression, and substance abuse is what puts a child at risk.
Albano says if left unchecked, mental health problems can escalate, even leading to suicide in some cases. According to the Centers for Disease Control and Prevention, suicide is the third leading cause of death in young people between the ages of 10 and 24, resulting in approximately 4,600 deaths in the U.S. each year.
The point of stigma-free is that a lot of times families worry. If I identify with my child that they have anxiety and take them for help, the school's going to find out, the college is going to find out, their friends are going to find out. And the reality is we need to intervene. We need to learn that this isn't something to be ashamed of.
Creating a more positive mental health narrative is something this social worker, who launched the Stigma-Free initiative in her New Milford community, says will become even more important in the future.
Anxiety is everywhere, and I think that as technology and times continue to change, younger and younger children are going to be dealing with anxiety, and it's important that we recognize it and that we help them feel supported.
In Englewood, this is Sherry Karabin reporting for Jersey Matters.
All right, thank you, Sherry. When we come back, Parkinson's disease and dancing. There's a connection, but it's a good one. We'll explain when Jersey Matters continues.